As we recognise Pride Week here in Dáil Éireann, I am deeply honoured to stand before you, not just as Minister for Mental Health and Government Chief Whip, but as a proud mother, an ally and advocate for the full inclusion of LGBTQ+ people in Irish life. I am especially proud of who I am and who my family is. My son is a transgender young man. And seeing him grow into his own identity reminds me daily of the urgent need for compassion, dignity and fairness in public policy. His story is part of a broader narrative that we must honour by continuing to build a state that cherishes all of our children equally, that truly supports all its people without exception. Sometimes the debate in relation to trans issues rages on social media without facts or understanding. It can be very hurtful. We should all reject those nasty opinions from people who don't understand the hurt and pain for young trans people who have to navigate a difficult enough pathway in their lives. Pride is more than a celebration. It's a declaration of our shared values, equality, respect and community. Over the past decade, we've transformed Ireland, becoming the first country to recognise same-sex marriage through popular vote in 2015, to enact the Gender Recognition Act that same year, which allowed legal gender change through self-determination. Clearly, our work is not done. In just the last few months, we have strengthened hate crime legislation since December 2024. Ireland now has what is widely recognised as some of the toughest and most comprehensive protections in Europe, explicitly including gender identity. Our Department of Children, Disability and Equality has launched an updated national LGBTI inclusion strategy together with Belong To. We are introducing inclusive youth supports, including the Rainbow Awards programme in schools and youth services. Our mental health specifically, we have made historic advancements. Just last month, a new guidance and training resource supporting LGBTQI+ inclusion in mental health services was launched. This comprehensive guidance and training resource was developed with the Mental Health Commission. And on the 9th of July, I had the privilege of progressing the Mental Health Bill 2024 through all stages in this House, a landmark overhaul that embeds rights-based, person-centred care into our mental health legislation. In recent months, we also saw the launch of our 3-year implementation plan, Sharing the Vision 2025 to 2027, which includes a record €1.5 billion annual budget and the largest ever capital allocation of €31 million in 2025 for mental health infrastructure. However, I stand here today to acknowledge that the need to do more in one area where action is lagging: gender-affirming healthcare. Our programme for government 6 months ago sets out the commitment to ensure we develop a transgender healthcare service that is based on clinical evidence, respect, inclusiveness and compassion. And Cathaoirleach, I was proud to write that into the programme for government. And those words didn't come easily. Those words came from involvement with several trans organisations, working with the HSE, and this is where we felt was the best way forward. A recent EU report revealed that for many, first appointment waitlists in Ireland are simply way too long, leaving trans people stranded without access to vital care. We've seen the reports that confirm our trans health services are the least resourced in Europe. This is simply unacceptable. That is why our programme for government commits not simply to promises, but to practical, evidence-based plans. So Budget 2025 invested €770,000 specifically to develop a robust, clinically grounded transgender healthcare model. We have appointed a clinical lead, established a multidisciplinary advisory group, and have begun a community-based pilot to better understand and serve trans young people. We are committed to a service that is rooted in clinical evidence, respect, inclusiveness and compassion, moving away from overly rigid models and towards a resilient, patient-centred standards of care. I've met many young trans people in the last 5 years, and they're looking for respect, they're looking for compassion, they're looking for appropriate counselling, they're looking for support such as endocrinology, psychology, social workers, and psychology if appropriate. Not everybody will need it. And that's the multidisciplinary team that I and the Minister for Health, Minister Jennifer Carl McNeill, wants to develop. And we are working behind the scenes to develop it. But every single time that I list a meeting in relation to trans healthcare in my diary, it's FOI'd. Every single time I speak openly about trans, I will be trolled on social media. It is extremely difficult. We talk about a recruitment process. We cannot get people to work in trans healthcare in Ireland. I had a meeting yesterday. People simply don't want to work there because of the abuse, because of the vile, because of the venom that they are subjected to. And we will try really, really hard to deliver a service. I'm looking forward to visiting the service in Drogheda, for example, that supports many hundreds of young children and young people aged under 18. I do agree with you in relation to the service in Loughlinstown. I'm not convinced. There is a long waiting list there, but I'm certainly not convinced in relation to their model of care. In times ahead, as I said, I will continue working with Minister Carl McNeill and colleagues across government and the HSE to ensure we put this model in place and ensure it is supported by adequate funding. Supporting our trans citizens isn't optional. It is and must be a measure of our shared humanity. It is also a work in progress. The funding commitments, the clinical frameworks and improved access are only as strong as the promptness of their execution. But I am proud to say, as a mother of a young trans man living in Ireland, it's one of the safest countries in the world to be a trans young person. It really is. There are countries that you could simply not go to. And I do think we have to recognise that. I also want to recognise the work of the Department of Social Protection in relation to gender recognition when you turn 18, into the supports they give young people, the help they give in relation to accessing a birth cert, in relation to your passport. You have to go through the system to understand it, and they are absolutely exceptional in a turnaround within 10 days. We must, as a government, ensure that we monitor and reduce wait times systematically, as we do across all health services. We must publish a full model of care as soon as possible. We expand capacity in gender services, including examining the development of new regional hubs that have worked in other areas. We must stop exporting trans healthcare as if it is someone else's problem. And we must ensure continuity of care for those referred from other jurisdictions. I feel this responsibility personally. I have seen the distress the prolonged uncertainty brings and the courage it takes for young people and families to demand better. We must continue to meet that challenge head on with empathy, respect, dignity, resources and urgency. Let me also acknowledge the work of advocacy organisations belong to TENI, Chill Out in Waterford and others who have driven progress, raised awareness and held us to account. There is no replacing lived and living experience in the crafting of good policy, and I thank them for their partnership. The Pride celebrations for this year may have drawn to a close, but I say to all members of the community today, I stand with you. I hear you and I remain committed to action over my words today. Pride is more than visibility. It is the continuous demand for real change, and Ireland has made that demand manifest. From the ballot box to this House, to the health services that serve our communities, we will not rest until equality is lived out in every interaction. As a minister, mother and proud ally, I pledge that the lives of LGBTQ+ people, and especially trans children and adults, must guide the steps we take this year and beyond. Gorv Mahagat.
Okay, well done, Minister Butler. Thank you.